Exactly. So I guess we need to kind of like get into our question really.
Right.
We do have to talk about that, and I think that our question that's come in is one about, what did it say? It says, simply, my tooth turned black.
Yeah.
Could you give a little bit, elaborate on like why that might have happened?
Yeah.
Well, it's kind of tough, I find, to be able to diagnose something that without actually having an individual in the office. So I think probably our first wish would be like, how can we examine you? Is there a way for us to be able to do that? But in lieu of that, since we actually haven't done that,
right?
I think maybe we can go through a few things as to like why that might happen. Anybody have any ideas as to like why someone might have said that their tooth turned black? I can think of a few, but
Well, I think one of the things you have to question is was the tooth traumatized in some fashion?
Yeah,
that's the first thing.
That comes to mind,
up, right? And then the health of the nerve itself. Was the nerve alive? Is it? It's probably more than likely
not
necrotic.
Yeah.
And so when that happens, then oftentimes the tooth will become discolored, and it may not turn black, but it will turn darker.
Yeah, I think black is probably a little bit of an exaggeration, but it's just obviously darker. Obviously darker than any other adjacent teeth.
Yeah.
I mean, that trauma does come to mind when that happens here, and especially if they're not in pain, and yet it just starts to turn dark. Sort of like, maybe what's the first question I'm thinking of is, did you get some trauma, at some point in time, and that's usually when a story starts to evolve about how they bumped their front tooth, or at a much younger age, they always have a story, when it comes to the front tooth.
Yeah.
Well, there's a difference too between like if the tooth is the correct shape and it's just kind of like a shadow, the darkness, coming from the inside, like we were talking about with trauma,
right?
Or it could also like the surface could actually be slightly different than maybe the tooth next to it.
Different story with that,
which is a completely different scenario, which might be like decay or something like that.
Decay,
like very extreme decay, I guess. In that situation.
I'm not sure when the last time they had their teeth cleaned.
Right.
What are their habits that they have? What are your home oral hygiene habits? I think there's a few things, and then if it's on the surface like that, and it's either from decay or we call it tartar or calculus buildup, you probably also have some odor along with that you might also consider as part of the issue. So I think that is a good point about if it's intrinsic or extrinsic on the surface or in the tooth. There's a completely different thing, and it maybe even if there is something changed up around the gum above, say if it's an upper front tooth, is there something that's on the gum that looks different? And I think if somebody says that, they have this it comes and goes, a little pimple, that might show up, and they wonder what that might be, and that kind of leads to your first point, which is trauma. Is the nerve okay?
Yeah. But also, even when you have had a root canal and say that it's not restored with a crown, then oftentimes root canal teeth can become darker with time.
This is true.
Also, right? So I've had some patients who have had a root canal, and even with the crown in place, the root itself is turned dark. Right. So you can see if they have real thin gum tissue, and you can sometimes see a dark shadow
right at the level,
through the gum
level
tissue,
of the gum, right there, at the edge.
So that could be another reason.
That's true. So, Dan, quick question here. So, individual walks in and they have a dark tooth. Tooth is has already been restored with a root canal, but not with a crown.
Right.
What's like some of the things that you would do to be able to, brand new patient coming in to either question about or think about what to do?
Right. So if the tooth is discolored, I mean, the first thing you think about is talking about internal bleaching. So that's essentially where you take the same stuff that you use to kind of whiten your teeth. The root canal specialist or the endodontist would take that and kind of put it on the inside of the tooth,
right,
to kind of try to get rid of that discoloration. Because sometimes even with a crown, especially with a porcelain crown, you want to have a nice porcelain crown. Sometimes if you want to use porcelain, it will still show through.
True.
Right. Otherwise, you have to use like a metal base and might not look as nice.
Right.
So you want to start out with doing the internal bleaching and try to bring up the color, the whiteness of that tooth first.
Absolutely.
Before you even think about putting a crown on it.
Yeah.
And then depending on how much tooth is left, I mean, because it could have been, previously crowned. It could have had a lot of tooth left. It may need, build up or something
Sure.
like that before you get to the crown.
Yeah. I think another point I'd be thinking about too is that first and foremost, what do we do when we examine? We take an X-ray, and just want to make sure that at that point in time, as we start to think about how to improve the situation,
Right.
almost everything we think about doing is from the foundation up, or in this case, if it's an upper tooth, from the foundation down. Is the root canal a good one? Because sometimes root canals, after years, may leak or have an issue, or how was it done in the first place? Was it done well? Did they leave anything behind? And all of a sudden now you're essentially kind of putting a cork on a problem that is still going to have an issue, maybe potentially later on. So again, is this a tooth that's should be restored?
Because you don't even know how long that root canal has been there when they walk in the door. Right?
Absolutely, yeah. You certainly don't want to have someone go down that path of investing in trying to restore it if essentially the foundation isn't as strong as it can be, because who's going to build a house on unstable ground? Nobody really. Or if you do, you know what to expect.
You have to redo something.
You have to redo something. So yeah, I think those are other common things, and I guess there's also, of course, the smokers. The smokers can be the ones that can have a darkness, but often it's not like the one.
It's more generalized.
It's more generalized, when that happens. Yeah.
And that's like wine drinking and coffee as well. Can stain
I don't know
teeth.
anything about that. We also had another point. Is the person has a crown, and an older crown. You and I talked about this once, where somebody said, "What's that dark line around the crown?"
Right.
And so the older style crowns, as you mentioned, there have a metal base to them. And sometimes as the edge or the seam where the porcelain and the metal kind of join, sometimes you see a little bit of a halo or a scribed line of a darkness around there, that especially if at one point in time it was hidden under the gum tissue.
Right.
And then some time goes by, unfortunately we get longer in the
tooth.
tooth. Yeah, exactly. You get, things happen, so the gum changes, and it never usually comes down. It almost always goes up, or away from the edge of the tooth. And now you see the transition between crown and natural tooth. And that usually means that you have to think about switching, that crown, or think about if you have recession in one area. Then we had Dr. Zaleski on one time, where you can consider covering it with gum tissue. So there's many options. We just have to look at you and look at you as an individual basis to understand what the source of the problem is, and then we can actually understand what's the best solution, because there's many solutions. We've got like this big bag of solutions here, but there's only one diagnosis, and the proper diagnosis leads to the right solution. You have to spend some time with your dentist. Sorry, but when they're this handsome and dashing as this guy right here, you probably won't have a problem, ladies. There. So next time, let's see. I guess have we covered all our points here about that?
I think so.
Well, this is the Ben, Gary, and Dan show.
Yeah.
We'll see you next time. Take care.
Everyone.